Good morning, everyone. We have the first session on listening to learn. As we all know, it's very important to listen and then take our learnings ahead into action. So, from us, from the conference team, we have Peter Squares, we have Nirmalya Mukherjee and Indra Dos Shetri, who will be presenting very exciting learnings from their domain. And from the technical team, we have Azim, we have Surkraj, we have Sonalia and Ishika, who will be helping us to sail through this particular session. Just going to the first session, we have the first session by Peter Squares. His session is on Lost in Translation, Language Needs Assessment in Humanitarian Crisis. As we all know, if language is the most burden, especially in development sector, development communications, when it comes to humanitarian crisis, it's most difficult scenario. So Peter Squares will be guiding us through those insights which he has gained while working with the Rohingya refugees, and then he is the head of research in Translation Without Borders, and then immense of research being done among Rohingya refugees. And then as part of Translation Without Borders, he has been into understanding the reach, the element of human crisis, and how communications can play a role in that. Now, Pete is joining us from Aldilai. Over to Peter for your session on Lost in Translation. Let's see how far we have lost in translation. Welcome, Peter. Over.
Hi, everyone, and thanks, Sajai and everyone. The presentation is going to be played from your end or my end?
Yes, sir. We'll be playing it.
We'll be playing.
Okay. Yeah. Perfect. Okay. Due to the timing on the presentation, I didn't give much of an introduction. So as Ajay said, I'm head of research for Translators Without Borders in Bangladesh, working in the Rohingya response for entering my third year now. And so this presentation is some reflections from the last 3 years on particularly assessing the language needs of populations in crises. So perhaps we can just jump straight to the presentation. People affected by crisis have the right to information and to make their needs and views heard in their own language, in a format they understand and through channels they trust and can access easily. However, language remains a largely overlooked component of humanitarian action. Over the last 6 years, Translators Without Borders has conducted several language assessments for humanitarian crises, including the Rohingya refugee response in Bangladesh, Ebola outbreaks in the Democratic Republic of Congo, and health and risk communication during the COVID-19 pandemic. We assess language, information, and communication needs to inform effective community engagement. This presentation will share some key lessons learned, including impact and recommendations on effective communication with Rohingya communities and other marginalised groups. Information on the languages of crisis-affected communities is not routinely collected. Organisations tend to believe that local staff and partners can provide this information and that they work in the languages that the affected populations speak, but often this is not the case. In fact, as you can see on this slide, humanitarian organisations often make inaccurate assumptions about the language characteristics of the communities they support. This increases marginalisation of already vulnerable groups, especially women, older people, and people with low or no literacy. Our 2019 cross-border study found that 75% of humanitarians assume that the Rohingya and Rakhine languages are mutually intelligible, and that therefore most displaced Rohingya would understand Rakhine. Yet actually, only 38% can understand Rakhine, and only 24% of women. A similarly incorrect assumption was made about Rohingya who could speak Myanmar. Creating programming without data on language assessment excludes people from accessing vital crisis-related communication and impedes access to services that aren't in the right languages. It also prevents people participating in program design, getting their views heard, and holding humanitarians to account. In Bangladesh, our assessments have combined comprehension testing of existing communication materials in different formats, open and semi-structured interviews, focus group discussions, and structured ethnographic observations at health centres and other facilities in the camps. As of 2021, we have published 3 large mixed methods assessments, contributed to dozens of community feedback bulletins, and during 2021 alone we will have published 12 research reports, drawing on qualitative data we have collected in the camps, exploring the Rohingya community's language, information and communication needs and perspectives. We liaise closely with partners and sector working groups in Cox's Bazar to share and discuss our findings and learn from others' research findings, and have provided research-based guidance to partners on topics ranging from education and extreme weather preparedness to health, nutrition and gender issues. We've also analysed the experiences of Rohingya refugees during the COVID-19 pandemic to inform health programming and messaging. Behavioural change plays a central role in health communication. Effective health communication should convey clear, concise messages that can be easily understood. However, health topics usually include complex terminology like quarantine and social distancing. Translating these incorrectly causes confusion, which can prevent people from seeking medical aid when they need it. As our research on Ebola in the Democratic Republic of Congo found, failing to provide information in local languages led people to believe that they were not at risk and that Ebola didn't concern them. This communication oversight has life-threatening consequences on people's care-seeking behaviour. Our research also consistently finds strong links between language and trust. If a person can speak to a doctor or nurse in their first language, they are more likely to trust the information and treatment they're given. In public health crises, trust can greatly influence compliance with measures such as vaccination. Our research with female Rohingya refugees found high levels of trust towards community health workers because they have a long-standing presence in the community and provide door-to-door visits, which for many Rohingya women, this was their only way to receive health information and to ask questions about their health. Understanding the dynamics of trust is essential to building effective communication that keeps people safe and informed. Signage is crucial for effective communication in the Rohingya camps, yet appropriate and effective design often gets overlooked. In Cox's Bazar, signs tend to be text-heavy, often in English, sometimes with translations into Myanmar and Bangla. However, 65% of refugees reported to us that they did not understand the signage in the camps, and 61% could not read any of the 3 languages most commonly used on the signs. 83% can either read no English or only some numbers and letters. It's clear that the information on the signs was not reaching the majority of the people in the camps, and if people can't understand the signs, how can we expect camps to properly meet their needs? Workshopped how to improve signage, including reducing text, adding illustrations and localizing icons. Crucially, we found that things humanitarian communicators assume to be universally understood, like icons, are rarely understood. For example, the 2 hands diagram to indicate you have arrived was not understood by 80% of people we spoke to, and 76% said they would prefer a finger pointing downwards. 91% of the people we spoke to said that better signage would increase the likelihood of them using services. Testing materials like signage and posters with affected populations is a simple and effective way to ensure people can find the services they need. Sensitive topics such as sexual violence can incur even more language barriers. With sensitive, traumatic or otherwise taboo topics, it is vital that we know the most accurate terms to use to communicate information. Interestingly, the Rohingya language has no word for gender. Because of this, we found that the term gender-based violence was being mistakenly translated as violent women. The inadvertent impact on GBV programming is clear. Euphemisms also play a huge role. For example, in some contexts, words like staining, dishonour or oppression can be euphemisms for sexual violence. In Cox's Bazar, we found that the taboo surrounding words like rape was so great that women and girls were using euphemisms to refer to experiences of sexual violence that Chittagonian humanitarian workers simply were not picking up on. This meant calls for help were going unheard. We found similar critical communication gaps about mental health in Nigeria and life-saving risk communication on Ebola in the Democratic Republic of Congo. If we don't understand the ways in which people talk about sensitive subjects, we cannot be sure that we are properly identifying and addressing them. Understanding who in a community has the power to influence others and be listened to can greatly increase the reach and impact of communication. In the Rohingya refugee camps, Mudgees are the men who occupy a community leader role. Rohingya refugees consider them to be highly trusted sources of information. They have long been seen as a helpful bridge between humanitarian communicators and members of the affected population. However, we found that they face multiple language barriers that constrain their effectiveness as Rohingya leaders and communicators. These challenges are evident in communication between Mudgees and site management support staff, as our interviews with both groups revealed. Authorities and aid agencies tend to use Bangla and English in camp coordination meetings, languages which many Mudgees either struggle to understand or do not understand at all. Staff are sometimes asked to interpret meetings spontaneously into languages that Mudgees can better understand, but interpretation is not an easy skill. A lack of proper training on how to interpret can lead to information loss, compounding the issue. These challenges undoubtedly impact the Mudgees' ability to communicate information to and from the Rohingya community. Given the amount of trust people have in them, it is vital to understand how to properly meet their language needs so that they can transmit the right messages in the right way to the many people who look to them for information. The positive impacts of language support is evident. A recent evaluation of the Common Service for Community Engagement and Accountability, a collaboration between TWB and BBC Media Action, found that 84% of Rohingya refugees surveyed said that they feel they have the information they need to meet their and their families' needs. This is a vast improvement from only 23% in 2017. The proportion of refugees saying they feel humanitarian responders listen to them has also steadily increased. The prime takeaway from all of this is simple. Language is always more complex than humanitarian actors assume. Yet, addressing language issues is critical if we expect those we serve to understand and act on the information we provide and be able to make their needs and views heard. These recommendations, based on our research in multiple contexts and crises, will help reduce language barriers and increase the reach and impact of communication. Don't assume you know the language needs of the affected population. Collecting language data will help you better understand the language needs of the community. Verbal communication, either in person or for instance using loudspeakers, is typically the preferred method of receiving communication for most crisis-affected populations and especially critical for reaching women. Use a combination of communication formats and channels to reach the widest possible audience and test communication materials before disseminating information widely. Localizing the information you provide is also essential. This includes testing terminology to ensure it is understood by the community and is culturally acceptable and accessible to the different groups you work with. Lastly, ensuring that affected populations can participate in conversations about humanitarian action starts with making sure that they can participate in their preferred language and through channels they're comfortable using. Getting these components right will help them hold humanitarians to account for the support we provide. In the Rohingya response and in other humanitarian crises, language challenges continue to hinder access to quality services. However, these recommendations will help organisations and affected populations tackle these challenges, helping people listen and be heard no matter what language they speak. Thank you.
Thank you, Peter, for sharing those wonderful insights. I'm sure it's not politically correct. I mean, I don't want to put it politically correct there for that eye-opening session, but our eyes are always open, and I'm sure that it's action which need to be taken. As you already suggested that there should be non-verbal communications focus, and I think that the culture also need to be translated in a big way. As Urvashi was commenting in the box that when it comes to sexual assault, it's very, very critical. And Vidya was also mentioning about this is has an impact on all development communications activities. So I don't want to go much on it. I would like to request the delegates to interact with Peter for 5 minutes. So he has given us a timeline of 5 minutes so that we can interact with Peter and then move to the next session. And maybe at the end of the session, we can again come back with specific questions to Peter.
Thank you, sir. I request everyone to put in chat if you have any queries, and then we can take them up one by one. If you don't, that is also perfectly all right.
Yeah, so there is one question. Suman is asking, I wonder if there is a broadcaster working close to the camps. Any idea, Pete, on this? Teacher, if you're speaking, your mic is mute.
Sorry, the mute button wasn't working. There is actually a broadcast in the camp. There's a couple of radio teams in Cox's Bazar who do broadcast in the camps. I would have to double check the names of them because they're not coming straight to mind, but there are radio programs running throughout the camps, so definitely. I know that the BBCMA and us as well have assisted or contributed there as well. So yeah, definitely with the Rohingya community in particular, audio programs, whether it's through megaphones or handheld speakers or loudspeakers at the mosques in the camps, or on top of the vehicles driving around the camps, that's something we've found throughout our research as a preferred way of receiving information. Not so much radio and television, perhaps particularly due to accessibility, but those facilities are available. But definitely things which come to people in the home or in the streets are generally preferred ways of receiving information on a variety of topics.
Yeah, so maybe I would also request to share the Indian experience. I'm seeing Sanjeev there, I'm seeing Priya, and then I'm also seeing Vidya over there, who has tremendous experience in translating language and then translating culture as well for development communications in the Indian framework. Maybe during this session, I would request them to share their experience either in the chat box, or if they can request Surki can up their mic. So I think let's park the questions to the end of this particular session. If we have some questions to Pete, we will come back with those questions later. We are moving to the next session by Nirmala Mukherjee on communications failed, health communication targeted for tribal women and way forward in India. So he tells us how certain interventions have failed, especially when it comes to communicating with tribal women, and this need to be heard. Listened. And then Nirmala Mukherjee is the director of Month, and he is working in that position since 2003. And he has his PhD in HIV communications, and it's from the Madurai Kamaraj University. Over to you, Nirmala, to have your session. I would request the technical team to play his presentation. Yes. Over.
Yeah, thank you. Thank you very much. Hello everyone. I myself, Dr. Nirmala Mukherjee, has been working as the director and community media head in Month, an NGO working in the states of West Bengal, Arunachal Pradesh and Nagaland in India. We have been implementing the community media initiative for the last 11 years or so. Under that initiative, we have been running a community radio, participatory video and ICT for development in tribal language under the leadership of the tribal people. Today, I am going to present a study, namely Communication Failed, Health Communication Targeted for Tribal Women and Way Forward in India. The study was conducted in the district of Purulia, West Bengal, India. Next slide, please. The tribal community in India is disproportionately suffering from poverty in comparison to the other social groups in India. In Purulia also, out of 4 tribal households, 1 household is living below the poverty line. The district is regarded as the most underdeveloped dot in the state. Based on the Human Development Index, the district is ranked 16th among 17 districts in the state. In terms of health indicators, the tribal people are alarmingly lagging behind. For example, neonatal mortality is almost double among the tribal community in India. The area where the community media initiative is being implemented is regarded as the complete media dark area, resulting in widespread information poverty. In the entire tribal area where we have been working, there is no radio, TV and newspaper bearing ours. So it is quite natural that the tribal women have limited or no knowledge on sanitation and hand washing. Next slide, please. Non-availability of IC materials in tribal languages is a problem. Tribal women with limited education are landlocked with limited exposure to the information. Non-tribal health workers provide them with health information, and that often causes a language bar. Now, this study was conceived to know the effectiveness and outcome of a behavior change communication initiative relating to sanitation and hand washing among the tribal women in eastern part of India and to find out the way forward. Next slide, please. The study adopted an experimental design. 20 tribal villages were selected as experimental group, whereas 20 villages with the same socioeconomic status were identified as control group. In both the groups of villages, women aged between 18 to 49 years were selected randomly. Baseline study was conducted to ascertain the knowledge, attitude, and practice relating to sanitation and hand washing. Observation method was also used for validation of the data. Next slide, please. A detailed intervention was designed for a period of 3 months. The radio and video contents were prepared keeping in mind the stage theory or trans theoretical model. The audiences were divided into various groups with different needs of information. The local tribal women already involved in radio and community video initiatives were further trained in content generation. They prepared audiovisual materials in their own language and dialect, keeping in mind their culture and customs. Next slide, please. In experimental group, interpersonal communication by trained tribal women, narrowcast of radio magazines, broadcast of radio programs in the form of radio jingles, expert interviews, radio drama, live phone-in programs, personal anecdotes, and the like, and screening of community videos in the village assembly meetings were organized for 5 months. The personal anecdotes became very popular over the period of time. In control group, the existing communication channels were used for the same period without giving importance to communication in tribal languages and in community media. Next slide, please. Now, after the intervention, an inline study has been conducted in the 2 groups of villages to know the outcome of the both types of communication. A total 436 women participated in the study. Next slide, please. The comparison between the results of 2 studies, first conducted between April and May 2019 and inline between September and October 2019, revealed that community-based approaches coupled with communication in tribal languages by tribal women is effective in changing hand washing and sanitation behavior. We have followed the P process prepared by Johns Hopkins University. In the experimental group of villages, around 80% tribal households already submitted their application for building sanitary latrines, whereas in control group, it is only 13%. In experimental group of villages, 57% women reported that they have been cooking and serving food after proper hand washing as against 21% among the control groups. Next slide, please. However, in both the villages, availability of potable water is a problem. The women of the experimental groups of villages have significantly enriched their knowledge relating to sanitation, while they are found to be more motivated to adopt hand washing than their counterparts of the control group. Next slide, please. From the results of the study, it is quite evident that the existing health materials as well as approaches have proven not to be effective in promotion of sanitation and hand washing in the tribal community, regarded as the last mile of the population. The tribal people have different cultures, languages, dialects, customs, which should be given priority, and the health worker should be from the same tribal community to make the communication program effective. In the experimental group, it was found that culture of cooperation and community ownership are the most essential part for the effective health communication targeted for tribal women living in the margins. Next slide, please. Thank you. Thank you very much.
Thank you, Nirmalia, for sharing your experiences from West Bengal. We have time till 11:25 to interact with Nirmalia. I would request delegates to ask questions. And then when it comes to water and sanitation, especially in tribal areas, if we don't have potable water, it affects the community a lot, especially women, when there is that gender imbalance working. And then it's very difficult to communicate with them, especially when it comes to the behavioral change of using toilets. We have seen in India, since the Rajiv Gandhi National Drinking Water Sanitation Mission came into force, it was very difficult, when we started giving them toilets and they're not using it. and we could see structures of latrines, and when they started putting their firewood and all in those structures. So India has a very unique study in terms of water and sanitation, especially in tribal areas. So we are waiting for questions. I request, this is very crucial as far as Indian context is concerned. Vidya saying can fully relate to all the findings. Effective communication has to be customized to local needs. Yeah, and she also agrees onto that. And of course, peer education is the most important thing. And communications we study, especially when we work with communities, peer education is the most important thing. Otherwise, that ownership won't be there. So we'll wait for 2-3 minutes, or maybe any additional points, Nirmali, you would like to share with us in another 30 seconds or
so from taking cue from Vidya's point, what she raised, that when we are using this community media initiative, that means the people who are taking the leadership role, not from Calcutta, they are going there and preparing the content for them. It is not like that. It is basically, the preparing the content by themselves. So we are just giving the technical know-how that how they can create a content, or how they can use the technology, like editing the audio contents or editing the video contents, or how to take the photographs. So that's the things we have been providing. But the rest of the things, even the stories, even the things that is coming up in their own radio programs or radio magazines, they're coming up from the bottom only, not from us. So we don't have any kind of like a role to play in terms of content creation if it is in line with the government of India's policy. So that's the most important thing. And I must agree that one size fits all kind of a communication program would not be effective in the long run, and especially in the tribal areas where they have a distinct types of needs and distinct types of culture. So we need to be very, very, very cautious in when we are going to work with the tribal people.
Yeah, thanks, Nirmalia. So when it comes to water and sanitation, I think it's a more structured way how India has triggered its community-based water supply schemes and sanitation projects. It started mostly in Gujarat and Kerala, and then we are seeing a lot of this community-owned micro water supply and sanitation schemes in those states, especially, and we can also see those in Rajasthan as well. And a lot of initiatives have been happening in rainwater management mechanism, and where rainwater is basically used for household needs. So that particular behavior change has happened in a very clustered manner, and then communities have been empowered on that aspects. So maybe it's all, now it's 11:25. We'll wait for some questions, if any, and then normally we'll get back to you. Stay tuned.
Sure.
Yeah. So let's now go to the next session, where we have with us Indra Doch-Chetri from Nepal. He will tell us on how increasing listenership to radio drama by identifying audience needs and acting upon them, experiences of adapting Panchanama, Mother says, in Nepal. So this is a disruptive mechanism where more community engagement has been ensured for a radio drama in Nepal. And Indra is with the Helen Keller International as a senior outreach and risk communications professional, and then he works in the nutrition program. He has his master's in communications from the University of Bangla. And then I request Indra to take over. Thank you very much.
Hi, yes, thank you for the introduction. We will use the recorded presentation. Yeah. Yes, yeah, yes. We'll thank you. Thank you.
Hi everyone, I am Indra Doch-Chetri. I work as Senior Manager for Outreach and Risk Communication with the USAID's Swara 2 program in Nepal. Today I'm going to talk about how we adapted a radio program based on the audience needs. Just to give you an idea, Swara 2 is a multi-sector nutrition program in Nepal. As you see, we cover more than half of the geographical territory, the dark blue areas, and also we 40% of the population we serve. We have various channels. Just to give an overview, we have interpersonal counseling, we have community level events, we have also used or utilized the mobile phones, mobile technology, and finally the mass media programs. And today I'm going to talk particularly about Panchin Ama radio program that we adapted as per the emerging needs and evidences. So, Swara 2 is the follow-on of Suara program that was implemented in 2011 to 2016. So this program, Banchin Ama, was already implemented, started in 2013. Um, this was a weekly magazine format radio show, and this was complemented by another program, live call-in based program, Hello Banchin Ama. Uh, so in Hello Vanchinama, the audience questions recorded in the interactive voice response system were answered. So all of these were centrally produced, and we realized that that might be little off from the audience needs because, um, for example, if I'm an audience, me recording a question in interactive voice response system and waiting for another radio program the week or following week to listen to the answer was not that effective. And also, as all the programs were produced in Kathmandu, people didn't, connect. I mean, people found it difficult to connect to the, solutions, and also the resource persons. The answers were not local and contextual. That's why in 2018 we localize the program production. We build the capacity of local radio stations, and the program started production from 16 radio stations. So these 16 radio stations produced the program, but that was simultaneously broadcast live by other, radio stations as well. So from pre-recorded, we moved it to live, and we combined both program, the magazine format radio show and also the call-in component. Now, as the call-in component was live, the audience could, directly answer the question and receive the answer. More importantly, the answers they would receive were more contextual, were more closure, and that helped the program to be in proximity physically and also emotionally. So of course the coverage was important. So we utilized more than 130 radio stations to broadcast the program. And in the programs, as we localized, that allowed us to involve local health workers, other stakeholders to invite to the program and to answer to the audience queries. That increased the ownership of the program among other stakeholders as well. Now the health workers or the local leaders were the advocate of the Vanchinama radio program. And the evidence also emerged that Nepal had nearly universal mobile phone access. About also two-thirds of the mothers had access to a mobile phone. About half of the women had half of the thousand mothers were um, had internet-enabled access phone. So to address to these emerging evidences, we adapted the program into multimedia program, or we moved it also to Facebook and um, YouTube. So the audience were asking now for more relevant questions or more um, urgent answers. uh, that was not possible through our weekly radio stations. For example, in my child has a diarrhea or something that required immediate attention. So we started. We also opened Facebook Messenger for questions. The audience could put questions to our Facebook page and could receive answer 24/7. So that helped, to increase the followers on our Facebook page too. And one example I have put there, so how the mothers would ask the question and how we would answer. So the results were evident. In just 2 years, the awareness of the program had more than doubled from 31% in 2017 to 68% in 2019. So among these mothers who knew about the program, more than two-thirds had heard of it. Had listened at least once, or 40% of them listened to it regularly, or at least once a month. And our Facebook page had 35,000 followers without any paid promotion, and most of them have turned into loyal followers. I'm sharing a few testimonials from different stakeholders, like a health worker says Vantinam has been helpful to his work as well. A mother says, how the program was helpful to, take care of her daughter. And another father who has migrated to Gulf country is now, thankful to the program that it was useful while his wife was pregnant. A few implications for the field, I would say investment in research to identify barriers and acting upon them is important to increase programs' reach and uptake. And as development workers, we tend to put a lot of effort in designing the program, but less in continuously monitoring and being open to change. But I think that is very important in this, and we adapted everything here. We adapted the program design, we adapted the production modality, we adapted the content, and also we adapted the broadcasting channels and means. So that was, I think, very important for other field to listen to. And also we placed a mechanism for quality control in both in terms of the content, the message that the program disseminated to program shared was important to be um, true or correct. And also in terms of production quality, that the because the local radio stations may not have the optimum the capacity, but regular mentoring and coaching and follow-up monitoring, that a mechanism was put in place, and that's why the program remains to be high in quality as well as and content. And finally, in the fast changing world, radio intervention alone will not be effective now. This has to be complemented, and this has to be availed with avail to mobile. The radio sets are now almost extinct. So most of the people are using mobile to listen to the radio, if they do. And if they don't, they are most of the time with increased proliferation of smartphones and access to internet, they are going more and more digital. That's why we have to combine the traditional radio or traditional media uh, component, traditional media programs with the multimedia or with the internet based platforms. And I'd like to end this presentation by thanking my co-authors, Pooja Pandirada, Ramesh Tokal, and Kenda Cunningham, all of them working for Swara 2 program in Nepal. Thank you, everyone.
Thank you, Indra. So there are a couple of questions as well. So as Vidya was suggesting that radio is here to stay, we never imagined that radio would have evolved like this. Even it could survive the threat from internet. Now from that big wall radio, which took around 20-25 minutes to start working, now we have radio available on our handsets as well. So we used to learn that radio is a linear model of radio falls in the linear model of communications. Now it has become hybrid. So as you correctly suggested, it should be community oriented, and the way how you have dovetail with Facebook Messenger and all other OTT platforms is amazing. The way how it has been evolved, it's a model to be replicated, and I think India should, and other developing economies should also learn from such community initiatives. So we have a couple of questions. I'll read it out. Indra, since it's only been few years and as a pandemic emerged, did you face any challenges in running the radio program, especially funding related issues? Very, very important question, especially when you are running community-based radios. It's very important to understand how this was a challenge. Indra.
Thank you. I hope I'm audible. So yes, so far we don't have, because the program is solely funded by the USAID, and it's a key platform for Swara 2 program, the multi-sector nutrition program. So far we don't have that funding issue, but we are towards the end of the project, and we really the idea behind localizing this production was also to see if it's possible to sustain it from the resources of the local radio stations themselves. And I can see that that is already happening, though people, the radio stations have not replicated exactly the same model, but health and nutrition is now a key component of their programming. I think that is very important, the spillover effect of building capacity of local radio station. We not only build their capacity in terms of technical, because they had to be able to simultaneously broadcast from other radio stations. We had to help them create that network, and but also we help them to build the capacity of the human resources. We train them, and at the beginning we had the problem of quality control. That's why we even deputed one of our staff at the radio station so that the messages are correct, and so, but now we don't have to do that anymore. The radio hosts are doing that. So yes, of course, this will help in the sustainability, or even if the funding is not there, some of it will remain, not exactly the same program or the entire format, but some of it will remain there.
Well conceived, Indra, because though it's USAID funded, generously supported by the people of United States, but see, when it comes, they pull the plug. Formatted, it's not for USAID. There will not be sustainability for any kind of fundings. Externally funded agencies will exit. So then this model should sustain through community interventions, and the government and the communities should take it ahead, so that the dialogue between the communities should be there. Otherwise, project standalone will fall after this particular funding is over. So developing economies should always, as Indra correctly told, that find mechanisms to ensure community ownership, and then finance is one important thing which keep such projects and initiatives running. We have 2 more minutes before we wind up. Any questions from the delegates? So I'm seeing one question. Peter is asking for your information. A couple of organizations operating radio stations in the Rohingya camps are Radio NIF. Yeah, thanks, Peter, for that. So maybe quickly, I would request delegates to ask questions to Peter, Nirmalia, or Indra. Or I have a question to Indra, if you allow me.
Sure.
Indra, you have been one of the very few panelists who never been onto WhatsApp. Is this correct?
Yeah. So that was a technical issue now. That will be sorted. I have been, for example, I'm the graduate of LSHC training in 2007 in Turkey, and we were in the same training, and we continue to have that conversation WhatsApp. Currently, for a few days, that was a
Okay. So
temporary.
Sorry. So I was wondering how a communications professional have. I just wanted to know how that professional's life is without WhatsApp. So that's a technical glitch which you are away from WhatsApp. Then I understand it.
But thank you. But that's very important, because there is something different between India and Nepal. WhatsApp is not that popular here, we actually use WhatsApp to communicate to you, but here Viber is more popular. And for the audience level reaction,
Okay.
audience level communication, we use Facebook Messenger. That is mostly used here.
That's a wonderful thing to learn from you as well, Indra. Last 1 minute. No, it's already 11:40. So thank you everyone for joining this wonderful session. I would like to thank Peter, Nirmalia, and Indra for having their wonderful sessions here. I would also like to thank Azim, Sukraj, and Sonali, Shika for helping the team to sail through this particular session. And I'm sure that someone at the policy level and many of the communications professionals have listened to what they had said, and I think this will convert into action. So I welcome all to the next session. Thank you for being here. Have a nice day. Bye-bye. Jai Hind.
Thank you.
Thank you. It was great to be
Thank you
here,
so much.
thank you. Yes.
I'd like to just request everyone here in this session to keep an eye on their chat. Our volunteer Ishika has just put in information about sessions 5, 6, 7, 8. So please feel free to go into any of those sessions of your choice and continue on with us throughout the South Asia SBCC conversation. So I look forward to seeing you all in the next few sessions. I think we'll give it a minute so that people can copy paste the links if they need to, in order to jump from session to session. We'll keep it on for another 3 minutes and then we'll close it. Thank you all so much once again for being a wonderful, wonderful audience and not unmuting yourselves. It is always a joy, Ajay sir, to support you technically. Everyone have a great day. Thank you so much.